Hi guys, welcome back to my channel. If you're new here, my name is Erica and I do a little bit of everything on my channel. I'm a recent new grad nurse working on a labor and delivery for a prior nursing student, so I know all the struggles that you're going through, and mom, wife, woman, entrepreneur, all those things. Today I have a little bit of a different video for you guys. I'm going to be reviewing the TRAP Guide to Nursing Dosage Calculations workbook by 𝗕𝗢𝗪. And thank you so much, 𝗕𝗢𝗪, for going ahead and allowing me to review your product and giving our nursing students and new grad nurses a resource for dosage calculations. I know how so many people can struggle with dosage calculations, and it really is a make or break in the nursing program. And now we have a really good resource to refer to if you are struggling with dosage calculations. So if you want to know more about this product, then go ahead and keep on watching. Okay guys, so this book is for you if you're really confused and struggling with dosage calc and don't know where to start. It can be very overwhelming. Trust me, I know. Math was never my thing. But this book will show you how to break down and solve dosage calc problems and pass that calc class. There's easy math conversions, basic dosage calc formulas, IV flow rates and IV drip rates, PEDS, complex problems, and practice problems after each chapter, and of course the notorious therapeutic ranges and more. This package also comes with a 60 practice problem workbook, which is a $25 value. And if you choose to purchase this wonderful calculations system, you can go ahead and use my code SN25 to receive a $10 off coupon. I think it's $10 off. If not, I'll go ahead and leave everything down in the description box below. But let's go ahead and get started in what this book is all about. I love that it comes in a PDF format because I can take it wherever I go, and I can also go ahead and print it and bind it and just pop it in my bag. Now, as a new grad nurse, I still use dosage calculations. I work in a labor and delivery floor, and sometimes I can't wait for pharmacy to verify medication because I need to administer medication right away. Labor and delivery is it changes, it's quick, things are happening all the time, and if I need to administer an antibiotic and I need to know whether it's 1 gram or 2 grams for a GBS positive mom, I need to be able to calculate kilograms and know that I'm giving the appropriate dose. So let's go ahead and get into this system. So this system comes with so many pages of resources. It's insane, 119 pages. And goes a little bit about what Ms. 𝗕𝗢𝗪 is all about, the table of contents. So she really lays out the groundwork in her table of contents. Sorry. Filming problems, you guys, filming problems. The first section is the groundwork. It's how to make this book work for you, really tailoring it to your learning style. Also, tips for passing dosage calculations classes, frequent abbreviations. That is so important, you guys. Knowing abbreviations and what they mean, because the question's not going to say 3 times a day. It's going to say TID. So you really need to know those abbreviations that are commonly used. Also, administering pills, rounding, how to round, how to write down, super important. Also, those trailing zeros can really be tricky because if you put trailing zeros and there's something's written out, it could be just a huge mess. If you're giving like 1 milligram, or if it says 1.00, it can be misinterpreted as 100 milligrams. Huge problem, so make sure you learn all those important rules, and Ms. 𝗕𝗢𝗪 really does a great job of breaking those down. And then you have your chapters. The first chapter is conversions. She really breaks down conversions and gives you those practice questions in order to succeed. Chapter 2 is a little bit more about the need and the formulas, and having those practice questions to use those formulas on. So practice questions are the key, you guys. Do as many practice questions as you can so that you really can memorize those formulas that are needed. And then you have flow rates. Flow rates can be super tricky as well. Drops per minute using microtubing versus macrotubing. All those questions. And again, practice, practice, practice. Chapter 4 comes with more IV flow drip rates. And practice 5, it's complicated, girl. It's complicated. Complex questions. pulling the meat and potatoes of the question, leaving the fluff out. 𝗕𝗢𝗡𝗨 really does go into depth about how to do that. And then you have chapter 6, which is it safe or is it not safe? Therapeutic dosing. Therapeutic dosing is one of my least favorite questions because it's not a one answer. It's a multiple answer question. And 𝗕𝗢𝗢𝗪 does a great job of showing you how exactly to answer those questions. And again, pulling those meat and potatoes of that question to find your therapeutic range. And then you have your PEDS dosing. Now, PEDS dosing is very particular because you can have a pediatric patient that is 1 year, or you can have a pediatric patient that is 17 years. And they are based on weights because you can't give the same dose to a 1-year-old as if you were giving to a 17-year-old. So lots of weight-based questions there. And then you have a little bit of extras. So let's go ahead and go into this book just a little bit. I love how colorful it is. It's really engaging, and it's just really, you know, everything that is needed is highlighted. Your main points are all highlighted. It really is a great resource for those who are struggling. And then, of course, you have your basic abbreviations. See what I told you? See TID 3 times a day. It's not going to say 3 times a day. It's going to say TID. Or Q4 hours 6 times a day because you're giving it every 4 hours and so forth. So Ms. 𝗕𝗢𝗧 really does a great job of showing you those abbreviations and what they mean. And then you have, you know, pills. You have everything in this book. Zeros, super important to know your zeros because it can easily be mistaken. Just like I said, if you're giving 350 milligrams, it could be mistaken for 3,500 milligrams, which is insane if you're giving someone 3,500 milligrams of something. And also, if it doesn't make sense to you guys, then, you know, if you're giving 3,500 milligrams and it's like, how am I giving such a large dose? Then the answer is probably wrong. Look at your trailing zeros, for sure. And then in chapter 1 is all about conversions. She goes into all the conversions for you guys. Again, colorful pages, great resource to have. That's probably the most valuable chapters, chapter 1. Chapter 2 is, again, lots of colorful stuff. You have tons and tons of resources. I mean, she goes in depth. In depth. And of course you have your practice questions. Super important to use those practice questions as a resource because it really is going to be your make or break. You can know all the conversions in the world but not know how to use them and still get the answer wrong. So practice, practice, practice. And then you have your flow rates. I know flow rates can be really complicated sometimes, but 𝗕𝗢𝗢𝗪 does a great job of breaking that down and then giving you the formulas in order to be able to calculate flow rates. And then of course practice questions. And then you have all those, you know, flow rates, and then you have tons and tons and tons and tons and tons of breakdowns, which I love. Like, I need this. Give me the breakdown on how to get the question, because if I can't see it and how it was the answer, what, you know, how to come up with the answer, there's no way that I'm going to be able to find the answer. You know what I'm saying? And then you have just, I mean, tons of resources, you guys. It's great. And this is super important. Is it safe or not? Therapeutic range. It tells you safe, therapeutic, and toxic, because you can give a safe dose, but it might not be enough. So if you're giving a lower dose antibiotic and it's not enough based on weight, what's the point of giving a low dose antibiotic if it's not going to do anything? And then you can have the opposite end of the spectrum, which it's a toxic dose. So it's finding that balance of, you know, therapeutic range, which can be tricky because you're finding like 2 answers to know what the therapeutic range is. Anyways, once you start working in this workbook, I promise all of this is going to make tons and tons of sense. But as you can see, everything is broken down and really colorful, which I really love, because flipping through a boring textbook is not for me. And then you have your pediatric section. Pediatric, again, is weight-based usually, and everything is broken down. And then, of course, you have your practice questions. And then you have bonuses, you guys. These bonuses are really great. Intake, output. I had tons of these on my nursing calc exams. Super important and want to know intake and output, because I still record those intake and output every day for all of my patients. And being able to do that is super important to know if you're the patient has fluid balance and as well as if their kidneys are working appropriately. Especially since I'm a labor and delivery nurse, if I have a MAG patient, I need to be able to know that her urine output is adequate. And then you have all these little cheat sheets. I mean, look how great this is, you guys. Everything is so colorful, and I love the graphics that she gives you. I'm a visual person, so this type of system really does help for people who are more visual. And then you have your answers to your questions, and you have all the formulas needed. This military time. We use military time in the hospital, and it can be very overwhelming trying to convert your mind to regular U.S. time to military time. Super important, especially when they throw military time into a question about when is the next dose needed. And yeah, so you have tons of resources, you guys. 𝗦𝗢𝗢𝗪𝗡 did a really great job providing this to nursing students who are struggling with dosage calculations, even those who aren't, even those who just need something like basic and straight and to the point to learn those specific values and formulas. I hope you guys enjoyed this video. If you want to learn more, go ahead and follow me on all my social medias. Make sure you go to 𝗦𝗢𝗢𝗪𝗡's page. Let her know I sent you. Use that coupon code, you guys. I really worked hard for that, so make sure you use that, and let me know what you think of this resource, or if you have other resources that you'd love for me to review. I hope you guys enjoyed this video, and I'll see you in my next one. Bye.